Good morning, everyone. How are you? Hey, thank you. Thank you so much, Andrea and Karen Delaney, for having me here today. I really appreciate the opportunity to kind of mingle with you, to kind of learn about things with you, and to understand your concerns and maybe some of the options that you could suggest for the County Health Services Agency to think about and to improve services for the residents of Santa Cruz County. Like Andrea introduced, my name is Giang Nguyen, and I have the privilege and the honor to serve the County Health Services Agency, which is the largest department in the county, as the director. Just a little bit information about the Health Services Agency, known as HSA. HSA is the largest department in the county that has over 520 employees, and we 50% of what we do, we actually contracted out to nonprofits in the community to provide services in the community. And we have 5 main divisions. We have the largest division in our agency is the behavioral health divisions, which has mental health, community mental health, and substance use disorders. Very important division that we have in our agency. We also have the public health division, and the public health division serves the community with all the mandated essential public health services. We provide maternal child health that integrated with our clinics and also with our behavioral health for pregnant moms and children that have early signs and symptoms of mental health and substance use disorder issues and other primary care health issues. We also have California Children's Services there that serve children with handicapping conditions from ages 0 to 21. And we have emergency medical services. We manage ambulance services for our community. And just some example of the public health services. And then we have our environmental health services that serve the mandated regulatory requirements from the state and the feds that provide restaurant inspection, making sure the water we drink, the water we use is clean. And with sanitation, we do land use inspection. If there's some housing issue, we go out there to make sure there's no environmental impact. We do hazardous material prevention and management. If there's a spill of oil or some chemical environment, we go out and we help clean that up and make sure it's safe for us. And then we also have 3 primary care clinics that we directly operate in our community. And that is on Emmeline here in Watsonville and one on Coral Street to serve the homeless population, right? And then, of course, we have our admin division. So those are 5 divisions that have over 520 employees with a budget of about $150 million a year. So in a nutshell, that's a health services agency. And myself, I'm very passionate and I'm very supportive of behavioral health, because I am a psychiatric nurse at heart. I'm a registered nurse. I work in psychiatric nursing for over 15 years on the front line in the acute psychiatric hospital. And I also manage all the crisis setting in the jail and for the crisis intervention and the inpatient side for the county of Fresno for over 15 years. I became the behavioral health director after that. I also am a public health nurse. I'm very passionate about serving the public, the low income and the poor population, and making sure we look at population health in the context of social determinant of health. Because we need to look at everything that impacting the lives of individuals, not just one disease or one issue, but also we need to look at poverty, we need to look at education, we need to look at employment, we need to look at access to health care. And when I say access to health care, it's not just one primary care services or specialty services, but also mental health and substance use disorder. And we learned that over the years, I've read research that 1 out of 5 Americans in any given time in their lifetime would experience a diagnosable mental health issue. And we know the prevalence rate is high. And we know that the resources have not been available to serve people what we call demand, service on demand, meaning when somebody needs it, it's right there available for them. We don't have that. And we need to change that. And so my speech this morning is, first I want to thank all of you for being here and for having me here and spending a few, maybe 10 minutes of your time to listen to what I have to share. And I'm here to learn most of all, and I want to work with all of you, continue working with all of you to move forward in the very good healthcare environment now under the Affordable Care Act. It's a very exciting time for all of us. So wanted to say that wellness and behavioral health services is a very critical topic area for all of us. And this is the one that needing the mobilization of all of our community partners to work towards a solution. So I kind of mentioned about the Affordable Care Act. We call it ACA, and people also call it Obamacare. So the Affordable Care Act passage provided new opportunities for individuals who were uninsured or underinsured, and many of whom who have mental health issues and also substance use disorder issues, and they didn't have access to treatment. We have learned over time, however, that the treatment needs for this population is often very complex, with a lack of care over time, providing a lost opportunity for these early healthcare interventions that can possibly affect the recovery of illness over time. We also learned that the importance of integration of care, good coordination of care for people who have multiple issues in their life. And I'm talking about primary care health issues like diabetes, hypertension, asthma, people who have mental health issues, and substance use disorder issues as well. So we need to make sure that we provide the services that are right there for them so they don't have to go to many doors to get those needs met. And that's why over the last 2 years, the Health Services Agency, under the direction of our Behavioral Health Director, Eric Herrera, and the Chief Psychiatrist, Dr. Vanessa de la Cruz, and our Chief of Psychiatrists, and our Chief of Clinics, Amy Peeler, we develop an integrated care model within our primary care clinic setting on Emily and Watsonville. We have a team of clinicians from behavioral health that work inside the clinics. So when a patient enters the clinic for, let's say, child checkup or diabetes care, we have a team of psychiatrists there, social workers, nurses, and doctors that provide primary care there to help them at that one-stop stop. So they don't have to go to 1080 MLI and then 1400 MLI or maybe somewhere else. So we have worked on that very, very aggressively. And I'm very pleased to say that we have made progress, and we have received a lot of good feedback from patients in that setting. We have a lot more to do. This is just the beginning. You all probably heard about the drug Medi-Cal reform or expansion coming up. How many of you have heard about that? Great. So a little bit about that there's a lot of hope for us. So recently, the federal agency has approved for the state of California to implement what they call drug Medi-Cal expansion. And that would allow counties, like our counties, to opt in to say, yeah, we want to do it, to expand services to provide substance use disorder services for Medi-Cal populations. We know from the Obamacare in the last 2 years, almost 1 out of 4 residents of Santa Cruz County is now on Medi-Cal. And that's very good news. Yes, thank you, very good news. And we know with Medi-Cal, we can actually provide services and get reimbursed for those services so that we can bring more resources to our community. So we, as the Health Services Agency, is in direct communication and negotiation with the state for better rate, drug Medi-Cal rate to get reimbursed from the feds and the state to provide more services for clients who need substance use disorders. Right? So that's good news. We submitted our implementation plan to the state a month ago, and we heard from the state. The state came down to meet with us that our plan was the best one in the state thus far.
Wow.
So, thank you. Our staff worked really hard on that, and we had quite a few of you in the room that actually joined us at that meeting with the state. Our president of NAMI, Carol, was there, and I believe some of the folks from MHCAN was there as well to support us. So I think that's another hope that we have coming up. With that, we can really standardize treatment and assessment to make sure that everyone gets into the door, get assessed right away, and get treatment on demand as needed. So that's what we're working on. My staff helped me with some of the talking points, but I'm going to pass them because I feel like this is a long speech and I need to kind of save time for you. So We heard, so what do we know about the prevalence of mental illness and substance use disorder in our county, in Santa Cruz? Each year, 1 in 5 Santa Cruz residents, adults and children, are dealing with some form of mental illness. 1 in 5. Like I said earlier, that's national average as well. Close to 13,000 of them have a severe mental illness or serious emotional disturbance requiring intensive community-based services. 13,000 of us in Santa Cruz County. Despite this number, only 50% has been able to engage in some sort of treatment. That's wrong, right? So we need to change that. Now, for individuals in our county with substance use disorders, close to 22,000 Santa Cruz residents over the age of 12 are estimated to have a substance use disorder. 22,000, ages 13 and above, have a substance use disorder issue. Only 3,200 of them would accept treatment if it were available. And then only 1,500 of them get served each year due to a lack of capacity in our system right now. So that's not right either. Got to change that. And we're not unique. It's across the state, it's across the nation with the capacity and a lack of access issues because of funding and because of not doing so good of a job in coordination for care. We have to work together because we know we're never going to have enough resource. So we need to work together as a community to coordinate, and to make sure that we maximize the resources that we have. Last year, the Health Services Agency also implemented, with the approval of the Board Supervisor, strategic planning for the next 3 to 5 years for the mental health system and the substance use services system. And we also know that we have to be better at integrated care. We have to work with all of you in the community as well to bring services out to the community. We developed a mobile crisis team last year. We have a psychologist in the emergency room at Dominican Hospital to make sure any children or adult come in on a 5150, they get served right away. They don't wait around until the ED docs or the ED nurses seen somebody else in trauma, and then they get to see 5150 patient next. So we have changed that, and it's been very effective. Dominican has very graciously funded each year for us to have that position in the ED because they've seen the results. They just told us last week that we'll fund it again next year because they saw the outcome. So I'm very pleased to say that we are doing that. We also will try to expand more capacity in serving children and adolescents who are in crisis so that they don't have to go over the hill for hospitalization. We're going to try to increase the beds as well, working with telecare, who's serving the residents with the contract with the county for the crisis services and also the inpatient services here in Santa Cruz County. Excuse me. We heard about people with serious mental illness who lives 25 years shorter than individuals who do not have a mental health issues, and that is not right. And as a nurse, I've always been concerned about that, and I think it's a crime to let that happen. So we need to change that. So what can I do? What can we do at the Health Services Agency to help that? Like I said, we integrated the behavioral health team into the primary care clinics to make sure that those patients get served holistically, not just, you have a heart problem, we treat your heart, and then maybe you go over there to get your mental health issue treated. So we want to have a team, and we are working with the community, with all the safety net clinics in Santa Cruz to have that integrated model everywhere else as well. So without a well-coordinated treatment model, having a mental illness and chronic health condition leads to worse outcomes for treatment of those chronic health outcomes. So the last point I want to talk about is integrated care. What does that mean? I kind of mentioned that a little bit. It means, we have mental health staff, substance use disorders, addictions certified staff, and primary care staff working together in one setting, right? That's good. Co-location is good, but that's not integration. You agree with me? You have staff sitting in one place together. That's good. That's the structure we want to have. But that's only the beginning. So we have to use evidence-based practice that show how integration should take place. We have to measure outcomes. We have to collect data. And we have to really train different workforce that have been trained in their career in a different set. Social workers being trained in a different way. Doctors, primary care doctors got trained in a different way, and psychiatrists too. So we really have to make sure those people understand each other's language and culture, and to have the patient, the clients, as a center of service. So that is being done as well. We are working with UC Davis to beginning the training for our primary care doctors in the clinic settings to understand and to help assess clients with psychiatric conditions. So we are doing that right now to help bring that culture together so that we can serve people with mental health issues more effectively. So there are so many more things that I want to share with you, but as a wrap up, I think this is an exciting time for California. We are leading the nation, so that you know, the state told us this when they came to visit us. California is leading the nation in implementing drug Medi-Cal reform. And Santa Cruz is among the first 4 counties that submitted our plan to reform drug Medi-Cal, and we are so far the best plan there is in California. And so the state and the nation is looking at Santa Cruz in doing this, so I think it's an exciting time, and I will share more information down the road. Another exciting thing's coming up for California is the 1115 Medi-Cal waiver. The feds approved for the state to implement this waiver so that we can perform some demonstration pilots for the next 5 years with funding coming in, and it's competitive. So it's not a given. We have to apply and demonstrate that we can do it. And I'm organizing a webinar watching together with some key stakeholders in the community to try to implement a project called Whole Person Care Concept. And the Whole Person Care Concept is about building infrastructure, coordination, and services, including data sharing, including how to make sure that we notify each other when a client needs help. And so that pilot would be, if approved by the state, Santa Cruz, I want to look at the target population. I want to work on those who are homeless or at risk of homelessness, who have serious mental health issues, who have addiction issues, and also have some primary care issue as well. And so we want to work on that together. And then there's another project coming down that we'll be working with the Alliance on, is the Health Home Project. And the Health Home Project is pretty much about providing actual services to the target population. So with the Whole Person Care Concept, we will build infrastructure, coordination, we identify who will do what and how we share data. And then when the Health Home Project comes about with the Alliance and being in charge, we can actually use the actual service dollars to provide case management services, treatment services for that population. So it's very exciting. Drug Medi-Cal, Health Home Project, Whole Person Care Concept, and the integrated model that we're all working together right now. I think together we can connect the dots and move the needles together effectively in the next 5 years. So with that, I wanted to say thank you again for taking the time being here this morning. I'm very excited about this opportunity, and thank you for listening to my speech. Have a great day.